All right, everybody, buckle up, because we're diving into the deep end of psychology today, the stuff most textbooks just brush over. Real patient case studies. We're cracking open abnormal psychology. A casebook to explore what mental health diagnoses look like in real life.
Yeah, it's like way more intense than just reading dry clinical definitions, right? These cases, they really let us get inside what these diagnoses actually mean for people.
Totally. So, forget just memorizing symptoms. We're trying to grasp what it's really like to diagnose and treat these conditions. And we're going to start with someone named Paula, a woman who was utterly convinced she was having constant heart attacks.
Oh, and you'd be scared too, right? Imagine the feeling. Racing heart, dizzy, chest pains.
Totally. Anyone would freak out.
Right. But here's the thing. Doctors couldn't find a single thing wrong with Paula's heart, physically.
So here she is, successful, driven, but living with this terrifying fear. And get this, it starts messing with her work, too. She has a panic attack at the office. Imagine that, in front of everyone.
Yeah, that fear of it happening again, anywhere, anytime, it's awful. And that's when the diagnosis pointed towards panic disorder, specifically with agoraphobia.
Okay, so those sudden fear waves, that's panic disorder. But then, what's agoraphobia?
So agoraphobia is the fear of being trapped somewhere that escape would be difficult or help wouldn't be available. It's often linked to panic disorder because people start avoiding places or situations where they might have a panic attack and feel trapped. So in Paula's case, she was avoiding work because she was afraid of having another panic attack in the office.
That makes sense. The office can feel like a trap sometimes.
Yeah.
But what causes these anxiety disorders in the first place? Is it all, just in your head?
Well, yeah, it's in your head, but not how you might think. Like, remember Freud? Repressed impulses, that kind of thing.
Right, deep down, something's off.
Exactly. But more modern theories, they focus on this idea of oversensitivity to threats. Like your brain's alarm system is stuck on high alert.
Okay, so, we all have that fear of the dark thing, right?
Yeah.
Helpful sometimes, but not when it's constant.
Exactly. And what's interesting with Paula, her panic attacks seem to pop up around big life events. Her brother died, then her father, both from heart conditions.
Oh, wow. Talk about adding fuel to the fire. So
Yeah.
not just in her head, it's like this perfect storm of life events and maybe even like a genetic predisposition towards anxiety. So how do you help someone like Paula?
Well, the casebook talked about cognitive behavioral therapy, CBT, being really effective. It helps people like Paula identify and change those thought patterns that make their anxiety worse.
So it's like retraining your brain to not freak out so easily.
Exactly. And then there's medication. It can be super helpful in managing the intensity of that anxiety.
Right, like Zoloft or Paxil, those are for anxiety too, right?
You got it. Those are antidepressants that are often used for panic disorder. Important thing is, medication isn't a cure. It works best paired with therapy, right? To really tackle the root of the problem.
Yeah, finding that balance is key. So what worked for Paula?
Well, she started on Zoloft, and it did help. The panic attacks were less frequent, less intense, but just as important, she stuck with therapy for 7 months.
7 months. That's dedication. What kind of stuff did she work on during that time?
A lot of stuff. She learned how to manage her fear, how to challenge those anxious thoughts, how to not let them control her life. And that's the key, right? Give people the tools to cope with their anxiety so they can start living a fuller life.
That's so encouraging. It shows that with the right support, even something as overwhelming as panic disorder, it can be managed. Okay, ready for a different but equally impactful condition. Let's talk about trauma and PTSD, starting with Sarah's story.
Trauma, it leaves these invisible scars. In Sarah's case, it's a perfect example. PTSD, post-traumatic stress disorder, nightmares, flashbacks, crushing guilt. Those were her every day after experiencing sexual abuse.
That's heavy stuff. You start to realize how deep trauma goes, right? It affects your sleep, your relationships, your whole sense of being safe in the world is shattered.
Exactly. And what people don't always get is how important social and cultural factors are in PTSD, like a strong support system. That can make a huge difference in recovery. But if there's stigma, well, that makes healing so much harder.
That's so true. It's like having people in your corner can be a buffer against the loneliness that comes with trauma. But judgment, man, that just adds another layer of pain. Speaking of layers, the casebook mentioned PTSD messing with memory, especially short-term memory. Have you heard of that?
Yeah, and it's wild. Some researchers think it might be actual damage to the hippocampus. The part of the brain that deals with memory shows you how deep trauma goes, affecting the brain's actual functioning.
Wow. So how did Sarah start to heal from her trauma? What did they do?
She did psychodynamic therapy, which focuses on uncovering and working through those unconscious conflicts, those past experiences that are kind of stuck.
So like peeling back the layers to see how those past experiences are messing with the present, right?
Right. In Sarah's case, she was able to manage her nightmares, sleep better, which, after what she went through, is huge.
Totally. Reclaiming a sense of peace, that's so important. The book also talked about how Sarah's relationship with her mom was complicated and how that played a role in her recovery, too.
Family dynamics, they're a big deal. It's not just about treating the person, it's about understanding the whole system they're in.
Right. Makes sense. Okay, switching gears to another condition that's often misunderstood. Let's talk about Fanny, who had OCD, obsessive-compulsive disorder.
OCD, it's one of those things people throw around lightly, but Fanny's story, it shows how truly debilitating it can be. This is intense stuff. We're talking about constant hand washing, a fear of germs that ruled her whole life.
Yeah, and the book doesn't hold back. It describes her washing her hands till they bled, being too scared to even leave the house. OCD, it's way more than just liking things neat.
Totally. And another thing that's interesting in Fanny's case is the cultural aspect. Her mom, she actually thought Fanny might be possessed.
Wow, that's intense. Shows you how important it is for therapists to understand cultural beliefs, right? You can't just ignore that stuff.
100%. It's about meeting people where they're at.
So what causes OCD? Is it, like, genetic?
Could be. Some research suggests it might run in families, but honestly, there's still a lot we don't know about where it comes from.
So we kind of know the what, but the why? That's still a mystery. So how did they treat Fanny's OCD? What did they do?
Sadly, her case shows how tricky treatment can be. She actually ended up quitting therapy even after making some initial progress.
Oh man, that's always tough to hear. It's a good reminder that OCD can be so hard to live with, and sometimes the shame around mental illness is just too much, even if it means not getting better.
That's real. We need to create spaces where people feel safe seeking help without judgment.
I couldn't agree more. Okay, let's shift gears to another category that's often misunderstood: mood disorders. We'll start with Allie, a wife and mom battling this constant feeling of emptiness. She described it as the grays.
Ah, yeah, the grays. That, my friend, is a classic way to describe major depressive disorder. People think it's just being sad, but it's way deeper than that.
All right, it's like all color gets drained out of the world. You're just going through the motions.
Exactly. And Allie's story, it captures that feeling perfectly. She wasn't enjoying things she used to love, her relationships were strained, and she just felt worthless. Depression, it impacts every single part of your life. It really is like that. Everything loses its vibrancy, and you're just stuck in this gray fog. And the thing is, there are so many ways to think about depression. You've got Freud with all that unresolved childhood stuff.
Right, like those old wounds resurfacing.
Exactly. And then you have the behavioral perspective, which might point to learned helplessness.
Learned helplessness, what's that?
Basically, it's like if you experience enough negative things in a row and you feel like you have no control over them, you might start to believe you're just helpless to change anything. And then on the cognitive side, it's all about those negative thought patterns, those self-critical voices in your head.
So it's like nature and nurture, past experiences, and what's going on in your head right now. Complex stuff. The book also mentioned how Allie's libido totally tanked. I mean, that's got to be tough on a marriage.
Yeah, it can definitely put a strain on things. Of course, you always want to rule out any physical causes for that kind of change, but it's often linked to the emotional and psychological weight of depression.
Right, so many things can impact libido. Speaking of serious impacts, we can't ignore the elephant in the room. Allie had suicidal thoughts.
Right, and that's serious territory, but clinicians, they're trained to assess the level of risk in those situations, figure out how serious the intent is, and develop a safety plan.
That's reassuring, that there are protocols to keep people safe.
Yeah.
So how do they treat Allie's depression?
Well, the casebook mentioned she was prescribed Prozac.
Oh, Prozac, that's one of those antidepressants even I've heard of. But how do they even work?
Honestly, it's complicated. Basically, they help to rebalance certain chemicals in the brain, the ones thought to be involved in mood, like adjusting the levels on a soundboard to get a more balanced mix. But just like with any medication, it's a balancing act, weighing the potential benefits against the possible side effects.
Finding that sweet spot between feeling better and, like, not having horrible side effects.
Exactly.
So did Prozac work for Allie?
It seemed to help, but honestly, what really made a difference for her was therapy, like really learning how to reframe those negative thought patterns and build stronger, healthier relationships. Those are essential for recovering from depression.
It's a good reminder that medication It's not always the be-all, end-all. Sometimes it's about learning those coping skills to reclaim your life. Speaking of reclaiming your life, let's talk about Ken, the businessman we met earlier. His story takes us to bipolar disorder, which is all about these huge swings between feeling super high and super low, right?
Yeah, and when we say huge swings, we mean huge EE. It's like during those manic episodes, people feel invincible, like they can take on the world. Their energy is through the roof, their thoughts are racing a mile a minute. They might do things without thinking about the consequences, like risky business decisions, spending sprees.
So that's the up part of the roller coaster, the manic phase. The casebook said during these times, Ken was like making reckless business decisions, spending money like crazy, and even having affairs. It really shows how those episodes, they don't just affect the person with the disorder, but everyone around them too.
Yeah, it's like a ripple effect. And then there's the crash, the depressive episodes. Suddenly, it's fatigue, hopelessness, loss of interest in everything. For Ken, this looked like really intense sadness, withdrawing from everything and everyone, and struggling to function at work.
Wow, the emotional whiplash must be brutal. Did Ken even realize he needed help?
He was one of those people who was reluctant to seek help at first, brushing it off as stress or just being a workaholic.
Yeah, like I'm fine, it's just how I am.
Exactly. And sadly, this kind of delay in seeking help is way too common, especially in cultures where mental illness is heavily stigmatized.
That's so true. It's like people feel ashamed to admit they're struggling.
Yeah.
So how did Ken finally get help?
His wife, Jackie, she really encouraged him to see someone, and the book mentioned he was first prescribed Prozac.
Wait, wouldn't an antidepressant make those manic episodes even worse?
You'd think, right? And for some people with bipolar disorder, it can. It's one of those tricky situations where antidepressants, while they can be helpful for some, can also increase the risk of triggering those manic episodes.
So it's not a one-size-fits-all kind of thing.
Not at all. Finding the right treatment for bipolar disorder, it takes time, working closely with a doctor, being open and honest about what you're experiencing.
So did they find something that worked for Ken?
They did. Eventually, they switched him to mood stabilizers, which are more commonly used to manage those ups and downs of bipolar.
Okay, so mood stabilizers. They can help even out those extreme shifts between mania and depression. What are some examples? Are there side effects?
Yeah, so the book mentioned lithium and dipakine.
Okay, and side effects.
They definitely exist. Lithium, it can cause tremors, weight gain. Some people even have issues with their thyroid. Dipakine, there's a risk of liver damage, and it can be really dangerous during pregnancy.
Wow, so again, it's all about carefully weighing those risks and benefits.
For sure. And medication is just one piece of the puzzle. Therapy, it's essential too, don't you think?
Totally. You need the tools to manage this stuff.
Right, like learning coping skills to deal with stress, recognizing the early warning signs of a mood swing, and building a strong support network. Those are all crucial for someone with bipolar disorder.
It's like you said, it's about giving people the tools to navigate those choppy waters and build a more stable life. Okay, ready to dive into a condition that's often misunderstood and surrounded by stigma? Schizophrenia.
Let's do it. Let's start with Henry, whose case really highlights just how challenging this disorder can be. For years, he'd been battling these really intense hallucinations, delusions, and just the isolating nature of schizophrenia.
The book really brought those hallucinations to life. Imagine constantly hearing voices in your head. He called them fires, which is such a powerful image.
It's easy to see how that kind of sensory overload, those voices, those visions, could make it really difficult to separate what's real from what's not.
Absolutely. And on top of the auditory hallucinations, the book mentioned Henry was compulsively scratching his arms. It's like his internal turmoil was manifesting physically.
Yeah, and those self-injurious behaviors, they're not uncommon with schizophrenia, sadly. And this is another one of those disorders that's often misunderstood, right? Like, people sometimes think it's a choice, but it's not. It's a very real, very serious illness.
Absolutely. And sadly, schizophrenia can lead to social isolation, which only makes everything harder. The book mentioned Henry was having trouble taking care of himself, like even basic hygiene, and he really struggled to connect with others.
Yeah, that isolation is a tragic side effect of the illness, for sure. It highlights how crucial community support is for these individuals. So, what type of schizophrenia did Henry have? The book mentioned a specific type, right?
Right, it sounded like disorganized schizophrenia.
Which, if you remember, is characterized by, well, disorganized thinking, disorganized speech, behavior that's out of the ordinary, and something called flat affect.
Flat affect, like showing no emotions.
Kind of. It's like their emotions are all internalized, turned inwards, so it's harder for them to connect with others. And there are a lot of myths out there about schizophrenia that we need to debunk, you know?
Yeah, like that whole split personality thing.
Exactly. Schizophrenia is not about having multiple personalities. It's a neurobiological disorder, and there's a strong genetic component, meaning it often runs in families.
It's a brain disorder, not a character flaw. And Henry's story, it really showed the impact this illness has, not just on the individual, but on their family and friends too. The casebook talked about how he'd lost his wife, his relationship with his siblings was strained, and he'd been hospitalized multiple times.
It's tough, for sure. So how did they manage his condition?
Well, medication played a big role. The book talked about antipsychotic medications like Thorazine and Prolixin.
Which can be incredibly effective in managing those hallucinations and delusions.
Right. It's not a cure, but it can make a world of difference. The casebook did mention some pretty intense side effects, though. Drowsiness, dizziness, and even a condition called tardive dyskinesia, which causes these involuntary movements.
Tardive dyskinesia is a big one because those movements, like the tics and tremors, they can become permanent. So it's this really difficult balance, weighing the benefits of the medication against the potential risks.
Right? Like, is it worth it? And that's why having those open and honest conversations with your doctor is so important, making sure you're making the best decisions for your situation. But medication, that's just one tool in the toolbox, right?
Totally. Therapy is super important too. I mean, imagine being diagnosed with schizophrenia. You'd probably need help processing that, learning how to cope, how to manage those symptoms in everyday life.
Right. It's about reclaiming your life, regaining that sense of control.
Exactly. Speaking of reclaiming control, ready to meet Ian, whose story takes us deeper into the world of paranoid schizophrenia.
Let's do it. What makes paranoid schizophrenia different?
Well, if disorganized schizophrenia is about, fragmented thinking and flat emotions, paranoid schizophrenia is all about those delusions of persecution, those unshakable beliefs that someone is out to get you.
Oh, wow. So not just paranoia, but full-blown delusions.
Right, and these aren't just fleeting thoughts. These beliefs, they take root and completely consume a person's reality. It can be tough to differentiate what's real and what's not.
And that's exactly what Ian was dealing with, right? The book said he was convinced the government was watching his every move, listening to his thoughts, plotting against him.
It's like living in a constant state of fear and suspicion. And sadly, those delusions, they can be incredibly isolating because they make it hard to trust anyone, even loved ones.
The book mentioned how Ian would confront people he thought were part of this conspiracy, which of course led to more conflict, more isolation.
It's a vicious cycle. And it's a good thing that whole double-bind theory about families causing schizophrenia has been debunked.
Yeah, thank goodness for that. It's about time we stop blaming families who are already going through so much. Okay, let's shift gears and dive into the world of substance-related disorders, starting with Rudy, who struggled with alcohol dependence, right?
Yeah, Rudy's story, it's like the classic example of how easily alcohol dependence can sneak up on you. It often starts subtly, social drinking, a few beers after work to unwind.
5 o'clock somewhere, right?
Exactly. But then slowly it takes over and you're stuck. You need more to feel the same effect. You get withdrawal symptoms if you don't drink, and you just can't seem to control it.
It's that classic slippery slope. You tell yourself you can handle it, it's just a few drinks, but then, bam, it's a full-blown dependence controlling your life.
Exactly. And the casebook, it didn't hold back. It talked about how Rudy's drinking, it was affecting everything, his work, his marriage. He even got 2 DUIs. Alcohol dependence, it doesn't just hurt the individual,
It's like those ripples spreading out, impacting everyone around them.
Right. And denial, that's a huge part of it, too. The casebook talked about how Rudy would downplay his drinking, blame everyone and everything but the alcohol.
Denial is a powerful drug. So how do you break through that? How do you even start treating something like alcohol dependence?
Well, there are a few different schools of thought. The casebook mentioned the disease model, where you treat alcoholism as a medical condition, focusing on complete abstinence from alcohol.
So the idea is that some people, they're just wired differently. Their brains and bodies, they just process alcohol differently. It's not about willpower.
Exactly. But some people argue that this disease model, while it's well-intentioned, it kind of removes personal responsibility from the equation.
Right. Like, why even bother trying if it's totally out of your control? So what's the alternative?
Well, there are behavioral therapies that have shown a lot of promise. They focus on changing those drinking behaviors, teaching people how to manage their cravings, how to cope with stress without using alcohol.
So instead of just saying, don't drink, it's about figuring out why someone drinks and giving them a different way to deal with it.
Exactly. And for some people, medication can be helpful too.
What kind of medication are we talking about?
Well, the book mentioned antabuse, which basically makes you really sick if you drink alcohol.
So it's like that old saying, nothing tastes as good as being sober feels. But in this case, it's more like nothing tastes good if it makes you want to throw up.
Exactly. Okay, let's switch gears to Chantal. Her story is a good example of what we call alcohol abuse, which often comes before full-blown dependence.
Okay, so like that stage where it's not quite an addiction, but those drinking patterns, they're starting to become a problem.
You got it. Chantal, she was a college student, and the casebook talked about how she'd binge drink on the weekends, leading to blackouts and all sorts of bad decisions.
Blackouts are scary. It's like hitting fast forward on your life, and then you wake up with no memory of what you did. Not good.
Not good at all. It's definitely a sign that things are escalating. And even in these early stages, alcohol abuse can have huge consequences. Chantal was getting into fights, missing work, her grades were tanking.
Right, it's not just a harmless phase, it's a real problem. The book mentioned how Chantal felt this pressure to drink because of her Irish heritage.
Ah, yes, the luck of the Irish.
Yeah.
But seriously, it highlights how cultural factors can play a role in our relationship with alcohol. Some cultures, they encourage drinking, some condemn it, some have a more complicated relationship.
It's all intertwined, right?
Hmm.
Culture, family, individual experiences, it's a tapestry.
Speaking of complicated relationships, let's move on to eating disorders, starting with bulimia nervosa. The casebook introduced us to Molly, and her story, it's just heartbreaking. She was trapped in that cycle of binge eating and then purging, trying to get rid of the food.
Yeah, in Molly's story, it really highlights how much pressure there is, especially on women, to fit those unrealistic beauty standards we see everywhere. It's like this constant bombardment of images telling us we need to be thin, and it's easy to internalize those messages and feel like you don't measure up.
And for some people, that pressure, it can be totally overwhelming. It can lead to some really unhealthy behaviors, like with Molly and the binging and purging. Can you walk us through that cycle a bit?
Sure. So imagine you're feeling stressed, anxious, or just down on yourself about your body. You start binge eating, which means consuming a huge amount of food in a really short amount of time.
Like way more than you would normally eat. Way more. And during a binge, it's like nothing else matters. It's just about numbing those feelings with food.
It's like self-medicating with food.
In a way, yeah. But then the binge is over and the guilt and shame set in. You're terrified of gaining weight, and that's where the purging comes in.
Purging meaning making yourself throw up or using laxatives.
Exactly. And that cycle, it takes a toll on both your physical and mental health.
The casebook mentioned how Molly's teeth were being damaged while the vomiting.
Yeah, that's common with bulimia because all that stomach acid, it wears away at the enamel on your teeth.
Not good.
Definitely not. And beyond the dental issues, there's dehydration, electrolyte imbalances, which can mess with your heart rhythm, your kidneys. Bulimia is serious business.
It's a life-threatening illness, not just a vanity issue.
Clay.
Molly's story also touched on how family dynamics play a role. The casebook mentioned there was a history of mental health issues in her family.
It's important to remember that these disorders, they don't exist in a vacuum. There are often underlying factors, family history, genetics, trauma, all of that plays a role.
So it's like this complex web of factors that contribute to these conditions.
Mm-hmm.
Speaking of family dynamics, the book also mentioned that family therapy can be a really important part of eating disorder treatment.
It can be crucial, especially for addressing those unhealthy patterns and communication styles that might be contributing to the eating disorder. But the go-to therapy for bulimia is cognitive behavioral therapy, CBT.
Right, CBT. It's like the gold standard for so many mental health issues, isn't it?
It's pretty incredible. With bulimia, CBT helps people identify and challenge those distorted thoughts about food and body image.
Like those thoughts that tell you you're not good enough unless you're thin.
Exactly. And it's about learning healthier ways to cope with difficult emotions instead of turning to food.
Okay, so rewiring those thought patterns and changing those behaviors one step at a time.
Exactly. And just like with a lot of other conditions we've talked about, medication might also be helpful, especially if there's anxiety or depression playing a role in the eating disorder.
Right, because mental health is rarely one size fits all. Speaking of, ready to tackle another eating disorder that's often misunderstood, anorexia nervosa.
Let's do it. So we're introduced to Florence, and her story, it's a powerful reminder of just how all-consuming anorexia can be. Like Molly, she felt that societal pressure to be thin, but she was also a perfectionist, always pushing herself to be in control.
And that need for control, that's a big part of anorexia, right? It's like food, weight, those become the battleground for control.
Absolutely. The casebook described how Florence, she became completely fixated on her weight and what she was eating.
Fixated how?
She was restricting her food intake to dangerously low levels, exercising obsessively, counting every single calorie.
Oh, wow. So her whole life revolved around food, or rather, not eating food.
Pretty much. She avoided any social situations that involved food, weighed herself multiple times a day.
It's like her world was shrinking, with food as the enemy.
And that's the scary thing about anorexia. It doesn't just affect your relationship with food, it affects your whole life.
And your health, right?
Oh, absolutely. Just like bulimia, anorexia can be life-threatening.
It's not just about being too thin.
Right. It takes a toll on your entire system.
The book mentioned Florence had stopped having her period.
Yeah, that's called amenorrhea. It's a common side effect of the severe calorie restriction and weight loss in anorexia, and it can have long-term consequences for a woman's reproductive health.
Right, and then there are all the other physical effects. Heart problems, kidney problems, osteoporosis.
The list goes on and on.
It's a lot, and it highlights just how important early intervention is for eating disorders.
Couldn't agree more. So how do you treat anorexia? It seems like a real uphill battle, especially given the denial that's often present.
Right, that denial is huge. The book mentioned how Florence initially denied she had a problem and resisted help.
Yeah, it's tough. But treatment for anorexia, it often involves a multidisciplinary approach. You've got therapy, of course, but also medical monitoring, sometimes even hospitalization if someone is dangerously malnourished.
Hospitalization. That's serious, huh?
Absolutely. But in terms of therapy, CBT is considered the gold standard for treating anorexia, just like with bulimia.
So again, challenging those distorted thoughts and developing a healthier relationship with food and body image.
Right. And just like with bulimia, family therapy can also be really helpful.
It's all about creating that support system, that safety net.
Okay.
Ready to navigate another sensitive, often misunderstood category, sexual and gender identity disorders.
Let's do it. But yeah, we got to be cautious here. Approach this with sensitivity and an open mind.
Absolutely. This is about understanding, not judging. So our first case in this category is Solomon, whose story highlights pedophilic disorder.
Right. And that means he experiences sexual attraction to children.
Okay, heavy stuff. And the book didn't shy away from the reality of his situation. He'd engaged in inappropriate sexual behavior with a young girl, which is obviously incredibly serious and disturbing.
Yeah, it's a tough subject to talk about, but we can't just ignore it, you know?
Oh.
And it's crucial to balance compassion with accountability.
What does that balance look like?
Well, it means acknowledging that pedophilic disorder is a mental illness that often requires professional help. But it also means holding individuals accountable for their actions and doing everything we can to protect potential victims.
That makes sense. So it's not about excusing the behavior, but understanding it better so we can prevent it. What causes something like pedophilic disorder? Do we even know?
It's honestly still a bit of a mystery. There are theories about potential links to childhood sexual abuse, hormonal imbalances, even structural differences in the brain.
So, like a lot of what we've talked about today, there isn't one clear answer.
Yeah.
What about treatment?
Treatment for pedophilic disorder often involves therapy, medication, or a combination of both. The casebook mentions CBT being used to help people identify and change those harmful sexual thoughts and behaviors. And sometimes medication can help reduce those urges.
Sounds like a long and challenging road.
It can be, especially because relapse rates for this disorder are unfortunately high. But there are specialized treatment programs out there that are making some progress in helping people manage their condition. Okay, ready to shift to a different type of sexual disorder?
Let's do it. What's next?
Let's talk about Emily. She was dealing with female sexual interest arousal disorder, which is basically a persistent lack of interest in sex.
Okay, so she just wasn't in the mood, ever.
Right, and it's more common than people might think. But Emily's story, it reminds us that sexual desire is complicated, and so many things can impact it. Hormones, stress, relationship issues.
Right, and it's important to be clear that this isn't about physical problems like difficulty having an orgasm or pain during sex. This is specifically about a lack of desire.
Exactly. For Emily, it was like this gradual loss of interest in sex with her husband, even though, from what the book described, they had a loving and supportive relationship.
So not about him, but something else going on. Did the book mention anything about her background?
Yeah, it mentioned that she grew up in a very conservative household where sex was taboo. So you can see how those early messages about sex being bad or shameful could have stuck with her.
Makes you realize how powerful those early messages can be, right?
Totally. And on top of that, there's this pressure on women, this expectation to be sexually attractive and responsive, always up for it.
Which can be a total turnoff, to be honest.
Right. It puts this pressure on women to perform, which can lead to anxiety and definitely doesn't make sex more enjoyable.
So communication is key.
100%. But easier said than done.
For sure. Did Emily and her husband talk about it?
They tried, but the book described their communication as strained, like they were both walking on eggshells around the issue.
Which is understandable, but not super helpful. So what did they do about it?
Well, Emily tried a combination of therapy and lifestyle changes.
Lifestyle changes? Like what?
Simple stuff. Managing stress, getting enough sleep, making time for things she enjoys. It's amazing how much those things can impact your libido.
Seriously. Take care of yourself, everybody.
Right. Mind, body, and spirit.
Love it. Okay, ready for a different kind of challenge? Let's talk about learning disorders.
Okay, let's do it. We'll start with Tilly. Her story highlights the challenges of dyslexia, which is a neurodevelopmental disorder that affects reading and language processing.
Dyslexia, I feel like most people have heard of it, but what does it actually mean?
Yeah, a lot of people think it's just about seeing letters backwards or having trouble reading, but it's much more nuanced than that. Imagine struggling to sound out words, spell correctly, or even understand what you're reading, even though you're smart and capable in other areas. That was Tilly's reality.
And it's not for lack of trying, right? It's not laziness. It's literally how their brain is wired.
Yeah.
The casebook mentioned that she always struggled in school, especially with reading, despite being a bright kid. She'd mix up letters, misspell words, and have a really hard time grasping the meaning of what she read.
Exactly. And sadly, a lot of people with dyslexia, they don't get diagnosed, especially if they're good at compensating.
Right, like they find ways to get by.
Exactly. And Tilly, she's a perfect example. She graduated high school, even went to university.
Wow, that's amazing considering how tough it was for her. But if you're not diagnosed, you don't get the support you need, right?
Exactly. And imagine the frustration of constantly feeling like you're falling behind, even though you're trying your hardest.
Yeah, that's got to be rough on your self-esteem.
Totally. And the book mentioned that Tilly would compare herself to her sibling, who were all straight-A students. She felt inadequate, like she wasn't good enough. And those feelings, they're so common with learning disorders because it's easy to internalize those messages that you're not smart or not trying hard enough, when in reality, you're just wired differently.
And the thing is, it's not just about the individual,
Yeah.
right? Like these struggles, they ripple out and affect the whole family.
100%. And in Tilly's case, there was also a family history of mental health issues and substance abuse, which, as we've seen before, creates additional layers of complexity.
Right, it's like you're already dealing with this learning disorder, and then you layer on top of that a chaotic home environment. It's a lot.
It really is, and it highlights how important it is to take a holistic approach, looking at the individual and their environment. So how do you help someone like Tilly? What does treatment for dyslexia look like?
The book mentioned these specialized reading programs, right?
Yeah, they focus on things like phonics, phonemic awareness.
Phonemic awareness.
Basically, it's about understanding the individual sounds that make up words, which is something that people with dyslexia often struggle with. And the key is early intervention. The earlier those programs are implemented, the better the outcomes tend to be.
Right, because the brain is still developing.
Yeah.
So catching it early is key.
Absolutely.
What about for older individuals like Tilly? Are there ways to help them?
Definitely. There are tons of accommodations that can make a huge difference, like extra time on tests, assistive technology, like text-to-speech software. There are ways to level the playing field. Okay, ready to meet Samuel, a young boy who struggled with dyscalculia. Dyscalculia. It's a learning disorder that affects a person's ability to do math.
And so kind of like how dyslexia affects reading and language, dyscalculia affects numbers.
Exactly. Imagine struggling with basic math concepts, calculations, even remembering math facts, despite having average or above average intelligence.
And again, not because they're not trying or they're not smart enough, but because their brain is wired differently.
Precisely. And unfortunately, dyscalculia often flies under the radar. It's not as easily recognized as some other learning disorders.
Right, because it's not always as obvious as struggling to read or write.
Exactly. But Samuel's story, it shows that even if it's not immediately apparent, it can still have a big impact. The book mentioned that he excelled in his other subjects but really struggled with math, which led to a lot of frustration and, sadly, took a toll on his self-esteem.
It's easy to see how that would happen, constantly being told you're bad at math.
Totally. And that's why early intervention is so crucial with learning disorders. The earlier we can identify and address those challenges, the better the outcome for the child.
So what helped Samuel?
The book mentioned that he started working with a tutor who specialized in dyscalculia, and that made a big difference. He was able to learn strategies to help him understand and work with numbers, which not only improved his math skills, but also boosted his confidence.
That's awesome.
Yeah.
It's a good reminder that these conditions, as challenging as they can be, are treatable, and kids with learning disorders, they can absolutely thrive with the right support.
100%. Okay, ready to move on to developmental disorders.
Developmental disorders, let's do it. What falls under that umbrella?
So we're talking about conditions that can really impact a person's behavior and their ability to socialize, usually starting in childhood. And our first case study is Bernard, a young boy who was diagnosed with conduct disorder.
Conduct disorder. That sounds pretty intense.
It can be. Think about a kid who's constantly getting in trouble, fighting, bullying, destroying things, lying.
So this is beyond typical childhood mischief.
Yeah, we're talking about a persistent pattern of aggressive and antisocial behaviors. And it's easy to jump to conclusions, right? Bad parenting.
Yeah.
It's tempting to simplify things, for sure. But Bernard's case, it was more complex than that. The casebook talked about his home life, how he grew up in a really chaotic and unstable environment. His mom struggled with alcohol. He was in and out of the system.
Man, talk about a rough start. That kind of early trauma, it can really mess a kid up.
Absolutely. Those early experiences, they can really impact a child's development, especially when it comes to learning how to regulate their emotions and build healthy relationships. But with Bernard, there was another layer to consider. The book mentioned that he had a history of seizures.
Seizures. That seems unrelated.
Right. But it made them wonder if maybe those seizures were playing a role in his impulsivity, his aggression. It's a good reminder that sometimes those behavioral issues, they have a medical component that needs to be addressed too.
So it's not always about bad parenting or a lack of discipline. Sometimes it's about what's going on in the brain.
Exactly. And it's a good reminder that when you're trying to figure out what's going on with a kid who's struggling, you got to look at the whole picture, including any potential medical factors.
Right, because it's all connected. The book also mentioned that Bernard was having trouble concentrating in school, like he couldn't sit still, couldn't focus.
Right, so that brings up another question. Could this be more than conduct disorder? Could there be some ADHD in the mix? Or maybe even a learning disability? It's like putting together a puzzle. You have to look at all the pieces.
So many pieces to consider. It really highlights how important those comprehensive assessments are. So you're not just treating the behavior in isolation, you're addressing the underlying issues too. Speaking of treatment, what's the approach for conduct disorder?
The book talked about something called multisystemic therapy, or MST, being a promising model.
Okay, what's so special about MST?
It's super holistic. It doesn't just focus on the child. It pulls in the whole system, their family, their school, even their community, because those behaviors, they don't happen in a vacuum, right? They're influenced by the environment.
Makes sense. Create a supportive environment, and the behaviors might improve too. What about medication? Is that ever part of the plan for conduct disorder?
It can be, especially if there's something like ADHD adding fuel to the fire. The casebook mentioned Ritalin as one medication that's sometimes used, but it's important to remember that medication, it's rarely a quick fix. It works best in combination with therapy and those environmental changes.
Right. It's all about giving the person the best possible chance to thrive. Okay, ready for another developmental disorder that's often misunderstood, especially in girls?
Let's do it.
Let's talk about attention deficit hyperactivity disorder, more commonly known as ADHD.
ADHD, right. And it's so often associated with those stereotypical images of little boys bouncing off the wall.
Right, like that's the picture that comes to mind. But ADHD, it can look totally different in girls.
Totally. Instead of that outward hyperactivity, girls with ADHD, they're more likely to be inattentive, disorganized, maybe more emotionally reactive.
So it's less about being physically hyperactive and more about what's going on internally.
Exactly. And because those symptoms are often more subtle, it can be harder to spot, and girls with ADHD, they might not get the support they need.
And sadly, They might even be mislabeled as lazy or ditzy when that's not the case at all.
100%. And that's what happened with Jackie, the girl whose case is featured in the book. She struggled to pay attention in school, had trouble staying organized, and had these emotional outbursts. But it wasn't that classic hyperactive presentation.
So she probably flew under the radar for a while, huh?
Exactly. And what makes it worse is when adults don't understand ADHD, they might tell a kid like Jackie to just try harder or focus.
Which, as we know, is not helpful.
Not helpful at all. And it can even be hurtful because it implies that the child is choosing to struggle when in reality their brain is just wired differently. And remember how we talked about the challenges of finding the right medication and dosage for ADHD?
Yeah, it's not one size fits all, that's for sure.
Definitely not. And Jackie's case is a good example of that. The book said she was initially prescribed Xylert.
Xylert, that's another one of those ADHD medications, right?
It is. But she had some really tough side effects, and she had a hard time remembering to take it consistently.
Yeah, remembering to take your meds, that's a whole other challenge with ADHD.
For sure. And Jackie's experience, it just highlights how important it is to work closely with your doctor, be patient, and communicate openly. Because finding the right medication regimen for ADHD, it's often a process of trial and error.
It's about finding that balance, managing the symptoms without creating new problems.
Exactly. And medication, as we've seen with so many of these conditions, it's just one piece of the puzzle. Therapy, it can be just as important, if not more so, for some people with ADHD.
Okay, so what does therapy bring to the table for ADHD?
It can help people develop coping skills to manage those challenging symptoms, whether it's difficulty paying attention, problems with organization, or emotional impulsivity. Therapy can give them practical strategies to navigate everyday life.
So it's about giving them the tools and support they need to succeed.
Exactly. And Jackie, she's a great example of that. The casebook mentioned that therapy helped her learn strategies to improve her focus, her organizational skills, and her emotional regulation.
That's great to hear. It's proof that with the right support, people with ADHD can thrive. Okay, ready to venture into a category of conditions that tend to be heavily stigmatized.
Let's do it. But yeah, we got to be cautious here.
Absolutely. We're talking about personality disorders, starting with borderline personality disorder, often called BPD.
Right. And BPD, it often gets a bad rap, you know. It's portrayed as being dramatic or manipulative.
Yeah, like the difficult diagnosis.
Exactly. But it's so much more nuanced than that. These individuals, they experience emotions so intensely, they have a really hard time maintaining stable relationships, and they're terrified of abandonment. Imagine feeling like you're constantly on edge, walking on eggshells, afraid of being rejected or left behind.
It sounds incredibly emotionally painful.
It can be. The casebook talked about Lisa and how her relationships were super intense and they always seemed to blow up.
Like those on-again, off-again relationships.
Exactly. One minute she'd be totally smitten with someone, putting them on a pedestal, and then the next she'd be convinced they were going to leave, and she'd push them away, often pretty dramatically.
It's like that fear of abandonment becomes a self-fulfilling prophecy.
Right. They're trying to protect themselves from getting hurt, but it ends up creating more chaos and pain.
And it's not just about relationships, right? The book also mentioned Lisa struggling with impulsive, self-destructive behaviors like substance abuse, reckless spending, even self-harm.
Yeah, those behaviors are unfortunately common with BPD. It's like they're trying to cope with these really overwhelming emotions, and they don't always have the healthiest coping mechanisms. It's like trying to put out a fire with gasoline, you know?
Right. It might make you feel better in the moment, but it only makes things worse in the long run. The casebook also mentioned Lisa had a history of trauma.
Yeah, she had a really rough childhood, experienced abuse from her father when she was young.
And that kind of early trauma, it can really impact how you see yourself, how you interact with the world. It's not an excuse for those behaviors, but it's a piece of the puzzle, right?
Absolutely. Trauma doesn't just disappear. It can show up in all sorts of ways. So how do you even begin to treat something as complex as BPD, especially with all that potential trauma in the background?
Right. It seems like you'd need a really specialized approach.
You got it. It starts with an accurate diagnosis, which, as we saw with Lisa, can be tricky.
The book said she was first diagnosed with depression, which doesn't seem that far off.
It's easy to see how that could happen, given how much overlap there can be between different diagnoses. It really highlights the importance of a thorough assessment to make sure you're getting to the root of what's going on.
Right, because the wrong diagnosis, that can lead to the wrong treatment, which isn't helpful for anyone. So once you have that accurate diagnosis of BPD, then what?
Well, there's a specific type of therapy that's been shown to be really effective for BPD. It's called dialectical behavior therapy, or DBT.
DBT. right? I've heard good things about it.
It's pretty amazing.
Mm.
DBT helps people learn how to manage those really intense emotions, those ups and downs, those feelings of emptiness and anger, and it teaches them how to build healthier, more stable relationships.
Which sounds like a game changer for someone with BPD. But it's not a quick fix, right? It's about really committing to the process.
Totally. It's intense, but it can be life-changing. And sometimes medication is used alongside therapy, not necessarily to treat BPD directly, but to manage any co-occurring conditions like anxiety or depression.
Okay, that makes sense. Treat the whole person, address all those layers, ready to explore another personality disorder that tends to carry a lot of stigma.
Let's do it. But yeah, you're right about the stigma. We got to remember, we're talking about human beings, not monsters.
Absolutely. And we can acknowledge the impact these disorders have on others without demonizing the people who have them. So what's next on the list?
Let's talk about antisocial personality disorder, also known as ASPD.
ASPD, right?
Okay,
And the case study for this one is Adam, if I remember correctly.
you got it. Adam's story, it's a good example of how ASPD can show up. Imagine someone who has zero regard for social norms. They lie, they cheat, they manipulate, and they don't seem to feel bad about it. They lack empathy and remorse.
Wow, that sounds intense.
It can be. The book described how Adam would lie, steal, engage in risky behaviors, and he just didn't seem to care about the consequences of his actions, not for himself or anyone else.
So it's like that piece that tells us right from wrong, that sense of empathy, it's just missing.
In a way, yeah. Individuals with ASPD, they often struggle to understand or maybe even care about how their behavior impacts the people around them.
That's tough for everyone involved.
Absolutely. In Adam's case, it really made them think about the nature versus nurture debate, how much of who we are is about our genes versus our environment.
Right, that age-old question.
Exactly. The book mentioned Adam's childhood was pretty rough. Physical abuse from his father, his mom struggled with her own mental health issues,
So a lot of potential trauma there.
a lot of trauma, and it makes you wonder how much of his ASPD stemmed from those early experiences versus, maybe a genetic predisposition toward those traits.
It's probably always a combination of factors, right?
Probably. And sadly, ASPD, it's one of the toughest personality disorders to treat, mainly because the individual often doesn't see a problem with their behavior. Like, they don't think they need to change.
So they lack that intrinsic motivation that's often essential for therapy to be successful.
Exactly. The book talked about how Adam went to therapy, but he wasn't really invested. He'd lie to the therapist, try to manipulate them.
Classic ASPD, right?
Exactly. And to make matters even more complicated, there aren't any medications that specifically target ASPD. Meds might be helpful for other issues like anxiety or depression, but for those core ASPD traits.
Not so much. So what can be done?
Honestly, with ASPD, treatment is often less about some huge personality transformation and more about trying to manage behaviors, minimize harm to themselves and others.
So things like setting boundaries, being firm about consequences.
Exactly. It's a tough road, but any steps toward accountability, any glimpses of pro-social behavior, those are victories. Okay, ready for one last case study to really challenge our diagnostic skills.
Hit me with it.
Let's meet Estelle, a young woman whose story highlights just how crucial it is to be thorough and to really listen to what the person is telling you. Because Estelle, her struggles, they didn't fit neatly into one diagnostic box.
So she was one of those people who was a bit of a puzzle.
Totally. Imagine this: mood swings, impulsivity, self-harming behaviors, tumultuous relationships.
Sounds like it could be a lot of things.
Exactly. She had symptoms that could point toward borderline personality disorder, maybe even a mood disorder like bipolar disorder. And there were hints of potential substance use issues too.
So how do you even begin to unravel that? Where do you even start?
Well, a good clinician, they listen, they observe, and they keep digging. And in Estelle's case, there was another layer to consider: the impact of trauma.
Ah, trauma. That seems to be a recurring theme in so many of these cases.
It really is. The book revealed that Estelle had been abused by her father, both physically and emotionally, when she was a kid. And that kind of trauma, it can manifest in so many ways.
It's like those emotional wounds can leave scars that impact how you see yourself in the world long after the trauma itself is over.
Right, and it can make those other issues, like the mood swings, the impulsivity, even harder to deal with.
So it's not enough to just diagnose the symptoms. You have to understand the context, the whole story.
Exactly. And with Estelle, it wasn't about finding the one diagnosis that explained everything. It was about acknowledging the complexity, recognizing that there were probably multiple factors at play.
Right, because mental health is rarely black and white. It's usually kaleidoscope.
Love that analogy. A kaleidoscope of experiences and influences. Okay, ready for our final case study. Let's meet Diane, a young woman who taught us about the powerful mind-body connection often seen in somatic symptom disorder.
Okay, somatic symptom disorder. That rings a bell, but remind me what it's all about.
Basically, it's when you experience physical symptoms that don't really have a medical explanation. Like the symptoms are very real, but they seem to be primarily driven by psychological factors like stress, anxiety, or past trauma.
So it's like your mind is saying, hey, something's wrong, but your body's the one sending out the SOS signals.
That's a good way to put it. And in Diane's case, she'd have these episodes of nausea and vomiting, especially when she was riding in a car. But get this, the doctors, they couldn't find a single medical reason for it.
Ugh, that's got to be frustrating. You know something's wrong, but the tests all come back normal.
Super frustrating. And what makes it worse is people with somatic symptom disorder, they're often dismissed as being dramatic or imagining things.
Which is awful because it invalidates their experience.
Yeah.
Just because you can't see the cause doesn't mean the suffering isn't real.
Exactly. It's so important for healthcare providers to be empathetic, to remember that even if there's no clear medical explanation, the person is still in distress.
Absolutely. So, if those physical symptoms are rooted in psychological stuff like stress or trauma, what do?
Well, you gotta address both sides of the coin. You rule out any potential medical issues because even if the root cause is psychological, there might be other physical conditions going on at the same time. But once those are ruled out, then the focus shifts to therapy.
The casebook talked about CBT being helpful for somatic symptom disorder, right?
It can be incredibly helpful because with CBT, you're teaching people to become aware of those automatic thoughts, those negative thought patterns that might be contributing to their distress, and then you give them the tools to challenge and change those thoughts.
So it's about empowering them to take control of their thoughts and hopefully reduce those physical symptoms in the process.
Exactly. It's about giving them a different way to cope with stress and emotional pain.
Wow, we have covered some serious ground today.
Oh.
We really dove deep into the world of abnormal psychology, exploring everything from anxiety and mood disorders to personality disorders, substance use, eating disorders, learning disorders, and even developmental disorders.
It's been quite a journey. These case studies, they really show the human side of these diagnoses, reminding us that behind every label, there's a person with their own unique experiences, struggles, and strength.
Absolutely. And if there's one thing I'm taking away from all these stories, it's that there's no one-size-fits-all approach to mental health. Everyone is different, and what works for one person might not work for another.
Couldn't agree more. And just as importantly, there's no shame in seeking help.
Not at all. In fact, it takes a lot of courage to reach out for help when you're struggling. So to anyone listening who might be going through something similar, please know that you're not alone. There is hope, and there is help available.
Couldn't have said it better myself.
This has been an incredible conversation. Thank you so much for joining me on this deep dive into abnormal psychology, a casebook. And to all our listeners, thank you for tuning in. We'll be back next time with another fascinating exploration of the human experience.